Welcome to Momentum Matters, your easy way to stay connected with what's happening across medicines, clinical care and regulatory updates in the UK. Each episode we'll be exploring the topic shaping practice in care settings today, from medication-related incidents to epilepsy, diabetes, allergy and anaphylaxis and everything in between. Join us as we discuss the developments, insights and real-world considerations that matter to care managers. I'm super excited for this episode as we got together three different professionals and three different perspectives on a well talked about topic and one experienced by way too many people, and that is stress. A big subject and some great hints and hacks to reduce it. So relax and listen into the chat as we get together for a great conversation about stress. So welcome to today's episode about stress, prevalent everywhere. I have some experts with me today in the studio. I'm very excited to have this conversation. I will get you guys to introduce yourselves in a second. So for those of you who have not had the pleasure of meeting before, my name's TeeJay. My background is pharmacy. I'm a pharmacist. And so have dealt with people with stress for many, many years and supporting people in the industry that we have already. So this is particularly for care managers and our care teams to be able to give you some hints and tips around how to manage your own stress and help people around you manage theirs. Lots of hints and tips as we go. So without further chit chat from me, let me get you to introduce yourself.
Hi, I'm Dr. Mehta. I've been an NHS GP for over 16 years, and now I also work as a stress management coach for leaders and business owners.
So who better than a GP and a stress management coach to talk about stress in the workplace, but particularly in the care industry?
Hi everyone, I'm Hollie. I'm a complex needs nurse by trade, and I've worked in services leading teams for a little while.
Yeah. What it's like the three musketeers, different professions within the medical services. And I think I'm sure we've all experienced stress in our own professions and have seen our own professions go through stress. And I think that has a massive knock-on effect in terms of the audience that we have today, in terms of care managers and care leaders, dealing with other professions as well. So stress seems to be something that everybody talks about and experiences. And so from all our perspectives, I think there's lots that we can share to give some hints and tips to those of you listening in today. So stress is something that can genuinely affect us physically and emotionally and psychologically. So tell us a little bit from a GP and a stress management coach, a little bit about what goes on in the body when we are feeling stress, what systems are involved. Yeah. I'm a physiology nerd. Share some physiology.
So I think it's important to talk about what happens when stress hits. So when stress hits us, we feel like it's a life or death sort of sprint or dash. But our stress response, it's a really clever system. It's designed just for one thing, just designed to make us take some sort of an action. So, in caveman days, it may be sort of running away from a saber-toothed tiger, whereas now it may be dealing with tight deadlines and things like that. So whenever our brain detects a possible threat, our brain activates our sympathetic nervous system. Releases our stress hormones, cortisol and adrenaline into our bloodstream, and that just primes our body and our mind for action. So, our heart starts beating quicker, blood rushes to our muscles, and we become really sort of focused and alert. So, that's fine.
I always say to people, it's your body's natural response. So you take you back to the caveman days, and it literally shuts down your thinking brain because there's a dinosaur. Run! That fight, flight, fright response. Either run or freeze and hope it doesn't notice you. Fight if you think you're hard enough. It isn't a time for pondering and thinking, is it? There's a time. Too late, you've been eaten. So it is meant for that immediate reaction. That's what it was originally for. It's a protection mechanism. It makes me smile because it is our sympathetic nervous system, but it's not very sympathetic, is it? So it's supposed to be a temporary response to an immediate threat. Threat's gone. Parasympathetic nerve kicks in, brings everything back into calm again. Unfortunately,
we're living in a society and world where it isn't just that immediate stress response. We're living with constant stress. So tell us a little bit about the impact on the body physically and mentally when that we're living in that constant stress that we've got right now.
So firstly, in modern lifestyles now, it's things like, all the emails, your notifications pinging on your phone. The important thing is all those things, they just stop our stress system switching off. And when that happens all the time, that's when it starts to wear down your body and cause all the problems that we see with chronic stress. But stress isn't really the main problem. It's not the enemy. It's the fact we don't allow adequate recovery. As you say, that stress response is meant to be temporary.
Yeah.
But for a lot of us, it's just running all the time.
Yeah.
And that's what leads to burnout.
Yeah. Yeah, and must be lots of care managers feeling as if they may be close to burnout. Hollie, share with us from a care point of view, because your nursing career has taken you through the NHS and into care services, much more recently, like it or not, into managing in care.
Yeah.
What are your experiences of the stress in our care environments right now?
There's a lot of stress in our care services at the moment. I think everybody's feeling the pinch. There's a lot more pressure on people. So, you've got the staff there that have got a lot more stress. They've got a lot more tasks that they need to complete. You said earlier, didn't you, about all the clinical skills that are coming into the care services. So, because the NHS is so good and technology's coming on so much, there's a lot more pressure on care staff to be keeping people alive, to be, there's lots and lots of new devices that people are in care homes with coming out of hospital. So there's a lot of pressure to be learning things like that in the care environment. So there's nobody really there to lead on. There's no specialist nurses within the environments for people to go to and ask questions. So there's a lot of stress in that sense, that there's a lot to learn, and an expectation that you are an expert in everything. And I think that's really difficult because we're human beings, we can't be experts in everything.
Right. Yeah. So what was your experience of the pressures of being a manager particularly? Because I know that was part of the role you didn't sign up for.
I didn't.
You kind of slid over into, I'm sure people listening are probably going to associate with that.
Yeah.
So in terms of actually like care management, either you having to do that manager's role or seeing other people in the stress of that role, what's that like on a day-to-day basis?
So I think I obviously I didn't want that role. I was never supposed to be in that role in the first place. I was kind of slid into that role, really. I was supposed to be in charge of all the clinical side of things, but kind of got swiped into the management of people. And I just found that because of all the stress that everybody's under on that sort of shop floor level, there's a lot of sickness, a lot of just a lot of general stress during the day. People are anxious a lot about things that they're doing. They need a lot of reassurance. And then as a manager, it's managing all that sickness. So you're constantly, trying to get shifts covered, trying to get people with the right skills to be on those shifts. And then so people are getting phone calls at home. So again, it's that response is they're never switching off. Like that constant when the phones go in, is it work? Are they going to make me come in and do a shift? A lot of people can't say no.
Yeah.
I know I'm the sort of person I can't say no.
Because if you work in the care industry and you love working in the care industry, it's because you care.
Exactly.
People who care are more likely to keep saying yes instead of saying no. Yeah.
There's that pressure because you feel bad then on your colleagues because they're not getting the support that they need. So as a manager, it's hard because people go off sick. So then you've got, long-term sickness to cover. You can't hire extra staff because staff are still on the books. So it's a big juggling act. And then on top of that, it's like I say, making sure people are trained to a good standard, making sure people are looking after the children and young people to a good standard, and doing all that side of things as well.
So, Milan, let me ask you in terms of what signs might indicate that someone's stress levels are becoming unhealthy and of a bit of concern, because sometimes we don't even notice it in ourselves because we just have to get on with it, aren't we? We like suck it up and get on with it.
Yeah.
So in your role with the work that you do with business leaders, etc., from a relieving stress point of view, what are some of the signs that people should either be like starting to notice, could be an indication for themselves or the people around them?
Yeah, sure. So with things like they're feeling mentally and physically exhausted, but also feeling emotionally drained, they'll say that they're feeling disconnected or distant from their loved ones at home, and at work their concentration's going, their focus is going, just the overall performance at work is going down. They're just feeling more irritable and snappy, and they can't sleep. That's a big one. Those are probably the main ones. And also some of the physical symptoms as well. So things like headaches, muscle tension, digestive problems, palpitations. But the interesting thing is that often I'll say, but I'm not stressed, doctor. But when you ask them more questions and explore their whole lifestyle, you find out these people, they're running businesses, they're managing teams, they're caring for other people, and you quickly realize that they've just been operating at like maximum capacity for too long, and their nervous system is just burning out.
Yeah, and you kind of get to a level before you get to that burnout. It's almost like you're in functional burnout first, aren't you? Because you're still going, you still think you're coping, but it's still, the pressure's still piling on around to the point where you just get to burnout.
Exactly. And what you said before was really true in terms of the fact that it's often either other people around us, so work colleagues or family members at home, that may notice it before we do, or we don't notice it often until it starts affecting our work or starts affecting things at home.
So those physical symptoms building up that our care managers with a few hints and tips might be able to spot earlier for themselves and other people, because if you can't take care of yourself, you can't take care of your workforce, and you can't take care of your clients, right? So I think the whole subject and being able to give some guidance and some, kind of extra advice is really, really important, particularly in the world of care when you're taking care of vulnerable people, be that children or adults, and to make sure that people are feeling the best they can to do the best they can. We already have enough shortage of staff in the industry already without it being compounded with people being off sick. So you've talked about some of the physical symptoms that are good to look out for and begin to recognise. You said one of the things that you said was the impact on sleep. Now, I know how massively important sleep is to a human body, and stress and sleep often very much linked. So how much impact, or what kind of impact, does lack of sleep have on the body and compounding that stress level?
Okay, sure. So we know that if we don't get enough sleep for a while, it affects the bit of our brain called the prefrontal cortex. And that is like the CEO of your brain. It's all your executive functions. So thinking, decision-making, focus, attention, that starts getting less effective. That bit of your brain starts actually getting smaller with time if you're chronically sleep deprived. And also what happens is that you can't control your emotions as well. So you become emotionally dysregulated when you haven't slept properly for a while.
Yeah, that's me. I know when I'm over time because it's super easy.
Exactly.
It's like, man, I must be too tired. But it is when your body goes to sleep, your unconscious mind or autonomic nervous system has this little job list, and it has to go through them sequentially. And if you don't sleep long enough, it doesn't finish its job. I mean, the purpose of sleep is that it regulates all of our body systems, puts us back into homeostasis, balance again. And so that whole massive impact is kind of like knock-on effect, isn't it? You're stressed so you can't sleep, and you can't sleep so you're more stressed. That emotional dysregulation is just compounded. So sleep, massively, massively important. Do you have any hints on sleep? Do people come to you because they're like, oh, I've just got to sleep?
Yeah, all the time. All the time. So there are lots of things we can do to improve our sleep. There's what we call the sleep hygiene measures, or a set of sleep rules. So really simple things like making sure you go to sleep at the same time and you get up at the same time. Try and cut down on how much caffeine that you're having. So some really common myths, especially when we live in a country of tea drinkers. So a lot of people think that tea hardly contains any caffeine, but it contains almost as much caffeine as a cup of coffee. So we know that if we drink caffeine after sort of 12 o'clock, 1 o'clock in the afternoon, it's still going to be in our bloodstream when we're trying to go to sleep. So having caffeine early in the day and trying to limit it to probably maximum 2 to 3 cups a day is a good thing. When we go to sleep, make sure you completely black out the room, and just a really simple 3-step rule as well. So trying to make sure you don't eat anything in the 3 hours before you go to sleep. Try not to drink anything in the 2 hours before you go to sleep. And for 1 hour before you go to sleep, stay off all devices, screens, etc.
Yes. Yeah. We are a nation of really bad habits when it comes to sleep, isn't it? In terms of eating, drinking, caffeine devices, man. No wonder we're not sleeping properly. Just as you were talking about caffeine there, it just sprung into my mind. I just this picture of delivering training to care teams, be that care managers or care staff, and just noticing how many energy drinks are on the tables as we go around. And what are your thoughts on energy drinks? Because I have my thoughts on energy drinks.
Absolutely hate them. They're lethal. People die from drinking energy drinks. You just stop them. Yeah, basically.
Yeah. Good night's sleep, you wouldn't need to top up with caffeine and taurine in the same way, because it is toxic to our nervous systems.
The energy drinks are toxic to your heart. Just put so much strain on your heart.
So just picking up on that, because when you're stressed, your heart rate's gone up anyway. And those sorts of drinks are putting your heart rate up even more. So that burden on the heart is
a lot.
Yeah. Interesting.
And again, if we're following on from that, if we're feeling stressed or anxious, if we then drink more caffeine, it actually heightens those, makes those symptoms more prominent and feel more anxious. And the other issue is that we get into a vicious cycle. So when we get to the afternoon, if we're feeling a little bit sort of lethargic and slumped,
your 3 o'clock circadian rhythm diff.
Exactly. So if we drink some more tea or coffee, I'll drink it because it's going to give me more energy. But it doesn't, and you then can't sleep, and then you're less refreshed for the day after. You just get into a vicious cycle.
Yeah. Interesting. Thank you for that. So stress and its impact on our care services. Hollie, you can speak to this, because what we're seeing in our training particularly is a lot of medication errors. A lot of staff being on training because they've made an error, or there's been errors in the services. Back in the pandemic, you expected errors to be sky high across all professions. What we expected to see was come out of the pandemic, everything level out again, would be all good, errors would come down. And they absolutely have not. In fact, this year, and we're March already? Coming out. Already, errors still climbing. So what are your thoughts, having been in that care environment, your thoughts around stress and medication errors and what you're hearing during training and things?
I think, they're climbing. There's a lot of pressure on people, isn't there? I think in COVID, we went to very much an online system, didn't we? Everything was online. We all did online training. Everybody did Teams, things on Teams. Nobody was face to face. Nobody had proper conversations, did they? And I think a lot of the knock-on effect now is because people have had their medication training online, so it's not being done properly and effectively and safely for people. So people aren't getting that knowledge, because like you always say, you've got a multiple choice quiz at the end of your half an hour online session, and you've got to get 7 out of 10 questions right. But you can do that as many times as you like until you've got your 7 out of 10 questions right. The other thing I was thinking about when you just said about the sleep rhythm, most of our care staff work shift patterns. So they tend to do late shifts, early shifts, long days, night shifts. They're not getting themselves into that rhythm, are they?
It's hard.
Yeah. Quite tricky as well, isn't it? So they're not getting that regular sleep. They're not getting that frontal cortex potentially isn't making those decisions properly, is it? So that will affect medication errors as well, won't it?
Yeah. Because if you're not sleeping properly and you can't think straight because your prefrontal cortex is not 'cause that's the whole point of stress, shut your thinking brain down, then a lot of the areas that we're seeing in services are doing it without thinking, quite literally. Just under pressure, rushing, blasé about it, familiarity, complacency, all of those things, because I haven't got time, so I'll just get on with it and then get on to the next thing.
Yeah. Yeah.
So in terms of like pressure of time in the environment that you were in, what were those pressures that you think that our care teams will be facing?
Well, you've got people off sick, so the training isn't up to scratch. So you've not got enough people trained on your shift when you're in work trying to do your medication safely. So you're doing medications potentially with maybe new people who haven't had a lot of practice with medications, or you're doing medication, policies are having to be tweaked, aren't they? I mean, we go somewhere and the policies are tweaked so that lesser experienced staff can then be second checkers for medications because there aren't enough people who are qualified. So I think it's a big...
And those are the environments that we're actually seeing errors go
up.
Because people are not being given the experience to do them properly before they're forced in, because there's not enough staff.
Yeah, because you'd think someone coming in new to it would be more thorough in their checking, but actually you've then got the flip side of that where they're not confident enough to be saying, no, I think that's wrong.
Interesting. So stress and medication. I'm a pharmacist, you're a doctor, I was a nurse. We have to bring medication in there somewhere, don't we? So how much does stress affect how medicines work? Because if you're chemically different in your body, what do you notice about people under stress and how their meds work?
I mean, stress can affect, many aspects of our physiology. So it can affect how drugs are metabolized, broken down, and obviously it affects the hormones as well that are involved in that process. So it can just affect it in different ways.
Yeah, because I'm thinking not only from a care managers and a staff point of view, but the people that they're looking after. If those people are under their own stresses, either because of behaviours and circumstances and illnesses and that kind of thing, and they're taking medication, then maybe their meds are not even working as effectively because of that stress that they're under as well. Maybe, point to raisers, making sure that our clients get regular medication reviews, particularly if they're under more stress and pressure for whatever reason, because obviously lots of different types of service users might be more stressed than others. It's interesting, there's so many aspects of stress, isn't there? I think it's so fascinating. So talking about medications for stress rather than how stress affects their medications. So common meds that people take to manage stress and anxiety. What current prescribing? What is guidance at the minute?
I mean, for a lot of people with stress, they don't actually need medications. And as a nation, actually, we need to get better at de-prescribing and prescribing less medications for it, because the medications have their place, but they can also cause a lot of problems and side effects as well. So it's just trying to create that balance. But for some situations, especially when someone's going through a really stressful period for a short time, then it might be appropriate to use a medication as part of the overall solution, but not as the only solution. It has to be, you have to be trying other things as well to help. So if someone's getting a lot of the physical anxiety type symptoms, sometimes doctors might prescribe beta blockers to help with that. If they've also got anxiety, depression, they may be put on a sort of regular daily antidepressant. And there are a few other different types of short-term anti-anxiety medications as well. So they have their place. It's just knowing when to use them and for how long.
Yeah, so it's kind of refreshing to hear a GP say, try other things first. So I think our common perception is like, I'm feeling stressed, I go to the doctor, they'll prescribe me some antidepressants or anti-anxieties, whatever the case may be. And it should be short term if they go down that route. And a lot of time I hear that people just get left on them for a long time.
I think the difficulty is, especially in an NHS GP setting, when you've got a few minutes, 10 minutes, 15 minutes with the patient, you have limited options. So prescribing things like an antidepressant, is a common thing. I'm not saying that's right or wrong, but that's how it is. But then patients' expectations change as well. So they expect if they're going feeling low, that they're going to get into antidepressants, trying to break that cycle. Like I said, I think they have their place, but it's just trying to prescribe it more appropriately.
Yeah. And I'm assuming I've seen the figures for a long time. Maybe I ought to go on Google. That's what I'm going after this. I'm going to Google that prescribing of that such a meds is still on the increase. It went sky high for a bit, didn't it? And I don't think it's ever really come down. And we certainly saw a massive spike during pandemic, as you can imagine.
I think one of the places that these medications do have is that they buy patients time to help get the symptoms under better control whilst you're waiting for the non-drug treatments to take effect, whether that's sort of cognitive behavioral therapy, doing regular exercise, all those other things. It just buys them time.
Yeah. So tell us about some of those other things. So in your role as an expert in helping people to not just manage stress, we want to manage it, do we? Want to minimize it as much as possible. Yeah. It should never go away because it serves us, but it's making sure that it's minimized. What are some of those things that people should be doing first, and even if they're taking those medications, because I think to know how to do that, to come back off the meds again, is really important as well. So talk to us about that.
Sure. So firstly, I believe that doing small daily recovery habits is much more important than trying to do any sort of big quick fixes. So I use the REST formula, which is about the 4 core pillars of our health. And I believe that when we strengthen and balance those core pillars, we can manage and sort of recover from stress a lot better, and we just become more resilient.
Yeah.
And in the same way, the converse is true. If they become weaker and out of balance, we can't cope with stress, and that's when problems occur. So those 4 pillars are recharging, exercise, sleep, and thinking, so our mindset. So if we just sort of very briefly go over those.
Hints and tips for
absolutely. So
care managers that need this.
So recharging, a lot of people do what I would call sort of fake recovery. So when you get home after work, you binge watch TV, or you doom scroll on your social media, or have a glass or 2, or sometimes more of wine. But those are actually distractions, and they're actually a low quality form of stimulation. You need to do true recovery. So during the day, it's about having small, even like 5-10 minute regular breaks. So that may be doing a stand-up stretch routine, getting some steps in, stepping outside for some fresh air, or making yourself a cuppa and having a chat with a colleague.
Yeah.
So when you do that, it gives your nervous system a chance just to reset and recharge, and give you enough energy to get through the next portion of your day.
Yeah. I can almost hear the voices from the other side of the podcast going, oh, chats would be a fine thing. I haven't got time to do that. Right?
Sure.
You haven't got time not to, though, have you? And like literally a few minutes can make such a massive difference to how the rest of the day plays out. So
I think, we all make our excuses, and, I've been guilty of that in the past. But for example, say I've had a difficult conversation with a patient, I've had to tell them they've got cancer or something difficult. I know that I have to step out and make myself a cuppa, or just do something for a few minutes to reset, because I'm going to have to deal with a completely new patient with a different problem, straight after. So I've realized personally the importance of that for me, and that will apply to everybody else as well. And you have to put yourself first, like you mentioned at the beginning, about the oxygen mask, putting it on yourself first before you can help those around you, especially if you are managing teams and other people.
And so, I often will say, you probably heard me say this, sometimes you have to be selfish to be selfless.
Exactly.
Yes, because if you don't take care of yourself, then you can't really take care of anybody else. So,
exactly. Yeah. So there's that sort of like micro recovery throughout the day, but also nutrition. So, eating healthy, regular meals.
I feel bad now because I've just stuffed a pork pie.
Not judging.
That's rare for me. It's like sort of down there.
So it's about eating food that's going to give you enough energy to allow you to do what you need to do, but also food that doesn't cause your blood sugar levels to spike high and come crashing down again. Yeah. Because you feel lethargic, you can't think properly. So, it's just about sorting the diet out as well.
Give me good foods, bad foods, good snacks, bad snacks.
So making sure with each meal that you get a good amount of protein. So chicken, fish, lentils, pulses. To help what your diet.
Broccoli.
That's
broccoli. It's broccoli.
Because having good amounts of protein will boost your metabolism, and it'll just keep you feeling fuller for longer. Having those sort of slow carbs like the lentils and the pulses will just slowly release a good amount of energy into your blood. So you still have enough energy, and you don't slump later in the day.
Good.
So
good. like healthy foods. We were in conversation about my
Don't
plastic
worry about mine.
greens
No.
earlier and water. Well, yeah, stay hydrated.
And then, so in terms of exercise, it's more about resistance training. So either weight training if you're going to the gym or doing body weight exercises like press ups and squats and things like that, which you can do without any.
Do you know what the world's worst exercise is? I don't know whoever invented it. It's my burpees. Absolutely. Oh my god, they're just.
It's universal, isn't it? Burpees are another go.
They're like torture.
Oh,
yeah.
But we know that if we do resistance training, it actually lowers our cortisol levels. Yep. So we release. So
great way to get them back out of our bloodstreams then. Yeah.
And we also know that if we do too much sort of like steady state cardio, actually can potentially put more stress on our system. It can actually raise cortisol levels. And the other important thing to do is if you're not getting enough sleep, then don't try and do a lot of exercise, because again, you're putting your system under much more stress. Prioritize, sleep first. So so doing sort of 2 or 3 sessions of resistance training a week is really good for you and your stress.
Good for your bone density as well.
Everything.
I remember that. See, I'm fit as well, nerd.
And actually, that brings me to a nice analogy. So if we put a certain amount of stress on our bones, they grow back stronger. But if you suddenly put too much force or stress onto a bone, it'll fracture, it'll break. And that's kind of like, what stress can do depending on different types of stress.
How about running? We have a runner in our midst. Tell them what the type of running that you have done in the past.
Well done.
Ultra running. So
wow.
long distance. 54 miles is my longest.
So
54 miles.
That's actually amazing. And I think that's fine. But again, like I said before, it's not so much the actual stress or the obstacle that we're trying to overcome. It's obviously, I'm sure you have to allow a lot of recovery for that. Otherwise, you stop feeling it sort of after, and you'll be able to do ultra running sort of less well unless you're allowing your body enough time to recharge properly afterwards.
Really don't do it so much anymore.
Yeah. Good on you. And yes. You have to take care of yourself a lot if you're going to do that much, for sure. What about, because a lot of people have joined kind of running clubs to get out there to socialise, and so that a lot of people don't like being in the gym. How is that reducing stress if it's kind of your joggers because they just love to jog?
And I'm not here to say don't do running. My wife's like a keen runner. She was running since she was 18, and I'm not. But I think again, if it's something that brings you joy, then that's clearly going to have and if you get out in the fresh air, that's going to be good for you mentally in terms of stress reduction. But again, as with most things, it's just sort of everything moderation is good. Doing anything excessively probably isn't good for
then,
you.
You don't want to be damaging joints or give yourself shin splints and all those kind of things.
Exactly.
Yeah.
So I put stress on your system in different ways. And the sort of final one, so thinking is, again, a lot of people come to see me saying that they're stressed, and there's lots of sort of things in the head that are, can make them feel stressed. It's about sort of trying to clarify what those things are. And we know that when we do sort of written practices like journaling and what I call brain dumping, so literally not thinking about it, just jotting everything that's stressing you, overwhelming you onto paper, and you do get that instant relief because you've literally taken it out of your head and then put it onto paper. But your brain can actually think about everything more rationally and logically. And when you do the journaling, you will sort of writing down all your thoughts, feelings, experiences, making sure you're being open and honest with yourself.
It's just between you and you.
It's just exactly. And then spending a few minutes sort of reflecting back on what you've written. And the amazing thing is when you do that every day, you literally start rewiring your brain and you start coming up with solutions to your own challenges. And then the final part, which I know it sounds a bit woo-woo, but there's actually a lot of scientific evidence behind it. So gratitude practice, just jotting down 3 to 5 things every day that you're happy and grateful for. And we know that if you come from a place of gratitude, you can't at the same time be stressed, anxious, or depressed as well.
Because you can't have both in your nervous system at the same time. It's impossible. So and people say, but but I can't choose. It just happens. Well, no, actually, you can choose.
Exactly.
We just have to train our nervous system back into looking for the positives rather than focusing on the negatives. And I think naturally we do focus on the negatives because that's our safety plan, isn't it, to keep us out of danger. It's just again gone into overdrive, gotten to balance it with looking for things that we're grateful for, things that we appreciate, and just asking questions in the moment of, what do I love right now? What am I excited about? What could I be excited about? Who do I love? Who loves me? What am I proud of?
Yeah.
You can't think of those things and focus on the negatives at the same time.
Exactly.
So,
It could be even much smaller things like, feeling, the sun on your skin, just really small things, but just appreciating.
the sun on my skin.
Exactly. It's
Yeah.
rare occurrence in this country. But
Yeah. I know. Why do I live in a country that's dark and grey and cold
I know.
75% of the time? That's why I'm
Nice weather
escaping
on
in May.
Friday, yeah.
We did. And this time of year,
Mm.
they said we were feeling this shift in energy, springtime. So do you find then that's just sparked another little thought off in my head in terms of seasonal affective disorder and that the impact through our darker months on stress levels? Do you see a correlation?
Yeah, especially in clinical practice, you see people are often more sort of presenting with, especially depression sort of in the winter months. But again, there are things you can do. So, for example, just making sure that you get enough vitamin D every day as well can help.
Yeah.
So, if those levels are dropping, which they will in the winter months, that can present as depression as well sometimes. So, and when you can, just making sure you can try and get out into whatever light is available.
Out, sunlight, breathing, moving.
Yeah.
Oh, good.
It's
Getting that
the simple,
stress
it's
out.
really, really simple things that make the biggest difference.
Yeah.
And just doing them every day. And I guess one piece of advice to the viewers in terms of how to implement all of this is that clearly we've discussed lots of tips and strategies. And my advice is just pick one, do it regularly for say 3 to 4 weeks, and then note to yourself, be your own biohacker. Has this worked or hasn't it? If it hasn't, swap it over with something else.
Yeah.
And if it has, then add in another one to try. And you'll gradually have it stack, as James Clear talks about in his book Atomic Habits. So you're building on your habits.
Yeah. So let's talk about the vagus nerve. I'm a vagus nerve geek. Everybody knows I'm a vagus nerve geek. So we've talked about your sympathetic nervous system that's not very sympathetic, that fight, flight, fight response. Talk to us about your parasympathetic nervous system, or our vagus nerve. So vagus means wandering. Of course, it wanders throughout our whole body. Very, very powerful nerve in our body. So share with us a bit about vagus nerve.
Okay. So firstly, we should think of our parasympathetic nervous system as our recovery system. And so the vagus nerve is one of the longest nerves in our body. And when we activate our vagus nerve, we activate our parasympathetic nervous system. And when we do that, it essentially takes us out of flight or fight mode and puts us into rest and recovery mode. So you can think of the vagus nerve like an off switch for our stress response. So we need to get better at learning how to activate it so we can just switch off and recover better.
Because we're in that stress for so much of the time now that we've forgotten how to switch it off.
Yeah.
It's kind of stuck on. So I often will describe it as we've worked our sympathetic nervous system so much. I've got one great big bicep and this one's like a knot in cotton. It's atrophied. So what should naturally happen when we come out of that dangerous situation, and it was temporary and you were parasympathetic nervous, brought everything back into balance, this one's got so strong that this one can't do its job.
Yeah.
And so it wants to bring the body back into balance, but it's like, oh man, I can't, I'm not strong enough, right? It literally drops out because we've lost the tone of the muscle in the system. So needing to be able to find ways to practice switching it off, to build this muscle as strong as this one so it can do its job again. Because I think that's what we're seeing in a lot of people, isn't it? And certainly what we're seeing in a lot of care teams is that they've just got stuck on the on stress mode and that off switch is just not working properly. So lots of ways that we can activate and strengthen the vagus nerve. So share with us some of those things. I'm going to add to it because I'm a vagus nerve geek.
Itching to go, but I mean, the good thing is activating the vagus nerve is actually really quite simple. So it can be doing things like slow breathing, walking, out in nature, making sure you try and get good sleep, doing the regular exercise. Just some of those simple things.
Yeah. And I think it's things that we kind of naturally know, but we don't know how they work and why it works. So therefore we dismiss them and don't do them. I think a lot of our care teams listening in will have come across vagus nerve stimulation from an epilepsy point of view. And that might be the only time that they've ever heard of it or think that that's all that it's for. But your vagus nerve, as you said, it's one of the biggest nerves in the body and the longest nerves in the body, coming down from your brain, attaching to your eye muscles and your facial muscles. So when you smile, you activate your vagus nerve, and you cause somebody else to smile and they activate their vagus nerve. Knock-on effect. I love that. And then comes down here, down the front of your neck, and the soft spot here is where your vagus nerve is. I think it's interesting that the ancients kind of knew how to bring the body back into balance, didn't they, through all of these things. They might not know the science behind it, but their practices balanced life out, didn't it? I'm sure they had their own stresses in their own times. So singing, do you sing because you're happy or happy because you sing? Both, right? Yeah, smile because you're happy or happy because you smile. Both has the same effect. So you talked about breathing. So those slightly slower, slightly deeper breaths. Again, a little bit like you would have got in meditation practices, yoga type breathing, all designed to stimulate the vagus nerve. Your vagus nerve, as it comes down the front there, spreads across your diaphragm, attaches to every single vital organ, wanders off, wandering nerve, vagus nerve, wanders off to your extremities. So things like ice plunge pools, splashing your face with cold water, an icy blast in the shower for a minute in the morning. Oh man, icy shower, I'll hum things. All things that we've seen talked about. I mean, a lot on the TV, hasn't it, about ice baths and things. Yeah. But I'm not quite sure that people understand physiologically what the benefits of those things are. As the girls in the office said to me the other morning, can we do Tai Chi at the start of every day? Yes, I'd love to do Tai Chi at the start of every day. Tai Chi, yoga, specifically designed by those ancient cultures to stimulate the vagus nerve. So we kind of have all these things that we didn't know could tap into it. It's not just about epilepsy. It's about the fact that when you stimulate your vagus nerve, it has so many effects because it's attached to so many parts of our body. So reducing anxiety, lifting mood, promoting good sleep, reducing inflammation in the body. You talked about symptoms of stress like headaches and migraines. Stimulate the vagus nerve, brilliant for those conditions. Indigestion, heartburn, gastroparesis, things like inflammatory conditions, IBS because of the stress. Exactly. Man, this is such a physical impact. We think that these things are just physical, but they've usually got that emotional basis, haven't they? When you stimulate your vagus nerve, lowers your blood pressure, boosts your immune system. There is no downside to stimulating your vagus nerve. And I don't know about you, but in my practices with both momentum people and what we teach, because we teach vagus nerve stimulation and then the benefits of being able to do that for yourself, and with the work that we do with young people, of course, there's been a whole little flurry of external vagus nerve stimulators hitting the market, which I absolutely love. And I think they are very, very effective. For some people, they're too expensive. For me, I think they're a great investment of £250 or whatever they are on average if you're going to use them on a regular basis. Because it's like any exercise, going to the gym and doing that resistance training or going jogging or whatever, you've got to do it on a regular basis for it to have that compound effect. Same thing with your vagus nerve. It's all very well building back the tone so you've got equal muscles, but you actually want this one to be stronger. So you've got that underlying sense of well-being instead of that underlying sense of nervousness and anxiety all the time. So your vagus nerve is free. Everybody's got one. Just need to learn how to tap into it. I mean, even like it runs to your extremities, just rubbing the side of one of your little fingers or any of your fingers will be stimulating a part of the vagus nerve. And so people don't even have to be like, oh, I can't do that deep breathing in public. Just rub the side of your finger and nobody will know you're doing it. But like you say, biohacks, little things that we can do that make a difference.
I was just going to say something about, obviously lots of different breathing techniques, but the one that's got some of the most evidence behind it in terms of activating the vagus nerve and just calming us down is one called the physiological sigh. So you basically take a deep breath in, and then you take a further breath in, so your lungs are absolutely full, and then you slowly breathe out. And when you repeat that for a few cycles, you'll instantly feel calmer. So it's quite good if you just feeling overwhelmed for whatever reason, or say you're feeling nervous before you get up on stage to do a presentation or something, it just literally calms your system down. The very same effect that, you know, a beta blocker tablet would do as well.
And it's free.
It's free and
it has side effects. Yeah. And I think we're a bit blasé, aren't we? Just like, just take a breath. And it's like this throwaway comment. But it's probably actually the most powerful thing that you can do, because when you're breathing in, if you're breathing properly, you're in a much more upright position. I mean, our posture can affect how we feel, because if we're caved in, then you're not breathing properly to get oxygen into your system. You can't think straight, so you're more stressed. The only thing that's interesting is knock-on effect. But if you're going to take a breath like that, and then at the top of the breath, breathe in a bit more, you can't help but be more upright. You've got the oxygen to your brain, and then with that deep sigh back out again, as you're sighing through your vocal cords, you're stimulating the vagus nerve.
Exactly.
Yeah. See? Vagus nerve. Nerd. So let's come back and wrap it up though, because we've talked about lots of things to do with stress, and not just the impact of stress, but I think some great hints and tips about how our care managers help themselves with their stress, help their teams, and help their clients with their stress. Because as a leader, you want to make sure that you're thinking straight, you in a place of good decision making. So, should someone be thinking, man, I think my stress is higher than I thought it was, what would be some advice that you would give to the people who are listening?
Okay. I would say, firstly, don't try every single thing to try and reduce your stress. I would just pick just one thing to focus on. So whether it's your goals, just try and improve your sleep, just try and focus on that for a while. And then, like I said, try and gradually add in some more habits.
Yeah.
But speak to somebody. So get some support, especially if it's affecting your work or home life, then, you know, see your GP or any other professional. Yeah.
If they wanted to reach out to you, because if this is what you've decided to take on as a new profession, if you like. I know you're still a GP and you're still practicing that, but I think your heart is around supporting people, particularly in businesses and leadership, with managing and minimising their stress. And so how would they get in touch with you?
Yeah, well, I'll leave you my social media details.
Yes, and we'll post that on the link for sure.
Yeah, we can have a conversation, take it from there. But I guess one sort of final point in terms of as an organisation. So I believe the culture of an organisation is set by its leaders, and you know, everyone else in the organisation looks up to you as role models. So if you're a leader and you're not taking care of yourself, and if you're stressed, that will literally trickle down the whole organisation. So as we said before, it's important to take care of yourself, and then you can help everybody else. And also just create a space where people can have open, honest conversations and check on one another, because that will help massively as well.
And I guess in an industry like the care industry, you can correct me if I'm wrong, because you've just recently joined us from that industry, but opportunities, handovers and things. What would you say are the opportunities on a kind of daily, weekly, monthly basis to start to embed this into a culture, to have some little conversations with teams?
I think definitely handovers. I think there's a culture, especially if you know, people are stressed. There's a culture of getting together at handovers or, you know, other times, and having a bit of a moan, having a bit, you know, being a bit negative. So I think if you can bring positivity into that, into handovers, into team meetings, into supervisions, any time that you're speaking to people or engaging your staff, just bring some positivity back into it, because negativity breeds negativity, doesn't it? So if we can get some of that negativity out the window somewhere else and bring that positivity in, you know, you can start bringing people up again.
Changing the focus just from the beginning.
Yeah, exactly.
Yeah. So, you know, what's one thing that you're looking forward to today? What's something that you are appreciating today, or you're grateful for at the end of a shift, if you're the ones leaving and doing the handover to the next team, just checking in, what was the best bit of today, even if it's been the most awful, goddamn awful, stressful day? What one thing was the best bit today? We'll often do that in the office. So what was the best bit
that was good, and thank you for going through this together, and you know, let's go out in a better place.
Absolutely. Just that positive feedback, just acknowledging people. So a lot of these things that can help, that they're free, don't cost anything, really small, but as long as we're intentional about doing them, absolutely.
Perfect. Well, that leads me to say thank you so much. I really appreciate you being here and adding value for our listeners today. Really appreciate both your expertise and all those hints and tips and things and experience that you brought to the session today. We're definitely sharing your details and your links so that people can get in touch and benefit from your expertise. Hollie, thank you for your input from experience point of view, because working with the care industry, never actually working in the care industry, the two sides are different. And I think it's been a brilliant conversation to have from a pharmacist, a GP and a nurse's point of view. So excited that this is the first of many podcasts. And I'm sure that you'll be invited back again to join us in another conversation. So thank you so much.
Wow, that really was a great conversation, right? Insights and helpful hacks to support you and your teams this year. And as promised, here's how to connect with Dr. Milan Mehta and, of course, with Momentum People. You can connect with Milan by looking for Dr. Milan Mehta on LinkedIn, Facebook and Instagram. You can email him at hello@milancoaching.com. And also what I love is he has a free 5-day email course, Burnout Warning System, with help system for business professionals to spot and stop burnout before it starts. So head over and get that free email course for sure. We'll put all the links in the podcast blurb so you can go to and see how all of those things are spelt. And remember to subscribe to the podcast Momentum Matters to get regular episodes to keep you inspired and up to date. Connect with us on Facebook, Instagram and LinkedIn, and go to www.momentumpeople.co.uk to view the list of courses and products we have to keep your team current and compliant in all things meds. So thanks for listening. See you again soon.